How you doing, guys? This is Dr. Sai, Specific Chiropractic. So in this video, we're going to talk about a lot of stuff, but actually the primary thing is not only the sciatica going on your left leg, but thyroid issues. So in this, gentleman, we're talking about your thyroid issues such as what? Let's go down the list here.
So because of thyroid issue, I have like just brain fog, just, trouble concentrating. Typically I have IBS and also just chronic fatigue and just like terrible like panic attacks once in a while.
Gotcha. And also, what about cold fingers, cold hands?
Oh, absolutely, yeah. Cold fingers, numbness in my right arm, hands, and then tingling in my feet. And I'm not diabetic, so.
Gotcha.
I came in to get all this checked out because there's something definitely going on here.
All right, so to the viewers over here, okay, typical symptoms for hypothyroidism, okay, that means less functional thyroid is the cold fingers and toes, okay, or the cold intolerance, sometimes heat intolerance as well, okay, brain fog, difficult to concentrate, really terrible short-term memory, okay, hair loss, okay, maybe gaining weight, okay, and what else is there? An interesting side effect is also ringing the ears, tinnitus, right? So we're going to take a closer look, see what's going on with all that stuff, right? Now we're going to start piecing together the history and along with what's going on in your entire body. So the fact that you're mentioning, okay, now we got 3 neurological issues. We got hypothyroidism, IBS, and left sciatica, all right? So now the areas in regards to thyroid issue, it's this region over here, this region over here. These two are traditionally involved with the thyroid right over here. It also could explain why you have that numbness going down on your left arm, your right arm over here. Okay. IBS is traditionally the 11th dorsal nerve over here. And that innervates you see here, right there, the small intestines, right? And in regards to the IBS, the reason why things short circuit the way they do is because in our small intestines we have these villi, right? And when food particles start trying to come in, we have these gates, right? That dictates, okay guys, what's safe enough to bring inside to our blood and which one we're gonna keep out, right? If there's some kind of misinformation at the gate, those gatekeepers are only following directions. Right? So therefore, just like no different like ordering takeout, it says, hey, can I have some food order to B2? What'd you say, B2 or D2? Sounds very thin and very similar. So all intents and purposes, these gatekeepers says, hey, whoa, that good food? No, it's toxic. We gotta keep it out. And that initiates that defense mechanism, bam, diarrhea, okay? So what we have to do is, we have to restore the proper nerve function and the communication to these gatekeepers is, hey, look, that meat, that's good. That garlic, it's a good guy. Any of these vegetables, good guys. Don't throw them out. Let's bring them inside, okay? So that's another aspect of it. The sciatica, okay? We're gonna take a look, see what's going on in this region over here, because, as we saw over here, boom, it's gonna affect pain going on down the legs over here. And those nerves also deals with prostate, testicles, cerebral colon, so you maybe experience constipation. That's where it makes things difficult, where do you have either IBS-C or IBS-D, so on and so forth, okay? It could be a different manifestation. It also depends on which type of nerve we're dealing with, so it's kind of hard to tell because we may have these double whammies. So we're gonna take a look, see what's going on here, and preliminary I already took a look on your x-rays already, so therefore it's going to be this left hip, this second sacral segment, the 5th lumbar, 4th lumbar. You have a potential upon the 2nd lumbar. I want to investigate more, and then of course it's mid-dorsal over there. That fellow over there deals with nerve to your stomach. That may explain why when you have that, you mentioned about before, you go hiking and that exercise exertion, you may experience that like GERD, okay, right there. Now on the x-ray analysis, so biomechanically, just like a chess grandmaster, I need to see how things are moving 10 to 15 moves in advance, okay? And also how things, not only in the future, but also in the past and the present. So by looking at your whole entire pelvic foundation, because I want to take a look at it here, even though you're talking about, oh, thyroid problem should be here, right? Should we look over here? But what's the point of it? Try to work on the top of the leaning tower of Pisa if the foundation itself is no good, because yes, we see all these distortions and all these twists over here, but we keep on tracing all the way straight down, even the pelvis foundation itself is not that great either. What I'm going to point out to you is this. I want to see this pelvis level. Actually, it is. I also want to see this line over here, smack in the middle, but we see it's slightly curved to the left. So there's a hint of an external rotation on that left hip, where it goes a little bit this way. But the more bigger clue what I see is this pelvic brim, all right? It's too narrow. I want to see a pelvic brim, normal should be like this. But because your pelvis tilted this way, and the viewers can see, this pelvic brim, the view of it, it's shrunk. So that tells me, when I see like this, it's shrunk vertically much less. It tells me this pelvis itself went backwards like this, both of them, all right? And it went so significant to the point that I see even your sacrum over here, normal should be 45-degree angle, but it's also vertical as well, all right? So I definitely want to take a look at what the heck is so traumatic, so bad to the point that it brought the sacrum back and even both of your hips backwards as well. So by looking at your sacral segments, I do see there's a potential issue right here. So we're going to take a closer look at that. And in addition to help confirm that hunch is what happened to your fifth lumbar disc. I want to see something like this. See this one over here?
Oh yeah.
It's so thin. Why? Normal movement of the lumbar spine should be like this. But if your foundation is so unstable, it moves so much, you're going to start grinding that disc away. Bam. That's what happened to that fellow there. So to make it grind like that, that's easily 15, 20 years worth. So that's been there. So that tells me that this thing, it's not a recent problem that just showed up, a few months ago, whatever it is. No, decades to cause that kind of wear and tear. Okay, it's no different like a door with the hinges, it's sagging. What's going to happen? The door is going to start wearing out at that door frame.
True.
Right? So there's going to be a pattern in terms of how much wear and tear that occurs to it. That's how we could tell this is roughly 15, 20 years worth of damage in there. And it's been there for quite some time. Even number 4 is start wearing out. Because when number 5 becomes unstable the way it is, the body says, wait a second, I don't know where you like this. It's just going to be like too much instability and vertigo.
Yep.
Right? So what is the body going to do? All the muscles, your postural muscles in your lower back is going to clench it to try to stabilize this. But if you clench so tight, what the heck? I can't move. Okay? So therefore, the bone right above it is also, again, going to start moving more again.
Makes sense.
So this fellow that used to be swollen and big like this, start wearing out and shrinking too. All right? So that is the degeneration pattern. So that's what we have over here. And then this is now number 3, taking a slack to try to move. And the problem is now we start to have this one also start to wear out and leaning backwards. That helps explain why with these multiple combinations, your whole entire upper back start to lean like this way. Mm-hmm. And there is no way to go like this way. Your body has to go, I look at my head over here. So that's where we see this huge arc going on over here. Right? So that causes even more biomechanical instability to this region over here. And that's why you start to experience more exacerbation of that hypothyroid symptoms. Because when we take a closer look in this region over here, I don't want to see any side slips. When we put a rule over here, everything lines up. Nothing's sticking out. However, when I do this, there's a bone sticking out over here, bone sticking over here, bone sticking over there. So, what do I mean by side slips? Well, if everything is being twisted like this, okay? We twist the bottom part so much, what happens?
basically kinks.
Right. It not only kinks, but you see it's already moving over to the left. Things are moving to the left. So your body is twisted so much over that way that it's forcing this bone over here to rotate quite a bit like this. Now there are these two bone structures that prevent it from moving any further than that, because if it wasn't there, it moved all the way off to the left. But we don't have that. Because it's locked in that position over there, okay, on the front part over here, what we see is, okay, it's rotating so much, it's going like this way over here. So we see that bone start sticking out to make it easy. Because actually, technically, we're looking from the back, so it's, it's sticking out this way. So to make it a little more correlated with this, it's sticking out like this way. So there's so much twist in there, the bone is side slipping over that direction. So whenever I see a side slip, that means there's so much torque in there, the nerve is not going to be happy on the left-hand side of it.
So that explains why the panic attacks happen and all this like weird thyroid stuff, because it's just pinching on there so much.
You got it. Everything's being really ringed up. So, but when we go up a little higher up, okay, we got another issue, okay, and that's where it correlates with this. This is a little more advanced biomechanics. It's this atlas. The atlas itself is supposed to be centered and leveled. It's slightly tilted this direction, but it's also tilting forward on the left-hand side. So the anteriority is on this way. So we got an ASLA on this way. So things that make that centered over here is I gotta find something that's PL, okay, a left rotated spinous, to recenter it this way. Looking up over here, that's a fit cervical. But here's the problem with that. And that's what makes this a very difficult thing to address. That fit cervical, normally, okay, and the way it's wedged right now, it's wedged like this way. So usually when it's wedged that direction, I want to see a right rotation of spinous. So there is like this way. No, what we have is left inferiority this way. So that makes this really challenging to try to recenter it and level this way. So because it's now tilting and rotated towards the left, the right side nerve, this fellow over here, nerve goes to the thyroid. So now we got double whammy. We got nerve dysfunction, this nerve going to the left thyroid, and we got the fifth cervical right nerve to the right thyroid. So both of your thyroid, the modules over here, they're not happy. They're not going to work as well as they should. Okay, you do have some nerve function for the fifth cervical to the left side, and you have some for the second dorsal nerve to the right side. So there's some functionality, but right now it's not a happy camper. So what we're going to do is this on examination. Most likely, it's going to be that second, that 2S over there. We're going to confirm that on you. I may need to adjust that fifth lumbar right afterwards. And the reason why is because by pushing that forward, this fifth lumbar is already backwards. So in other words, by adjusting this, it's already, your fifth lumbar is already backwards. So by adjusting your sacrum, it's going to push you more this way. Yeah, you're not going to like it. It's going to exacerbate, and you see it, the nerves pinch even more. It's going to exacerbate that left sciatica already. I may need to adjust the fifth lumbar, push that forward to line it up to ease the pressure off that nerve. I may have to do that. In future visits, I'm going to keep an eye on, we may need to address this left hip, okay? We'll see, I don't know, I'm not guaranteeing it, okay? And then I like to see, most likely because this is a compensation turning into subluxation, that fourth lumbar, we'll keep an eye on it. The 11th dorsal, I definitely want to confirm on that because it's not a happy camper on this x-ray over here, okay? And most likely it's going to be this 6th dorsal over here, either the 5th or the 6th. We'll confirm that on you. And then that second dorsal, that's almost a given, and same thing with that 5th cervical as well, okay? And then after all that fun, your atlas over here, most people that have atlas is tilted this direction. Yours is tilted downwards. So you have anterior and inferior tilt of the atlas. That's why your occiput, it compensates by going upwards.
So that explains like the headaches at the back of the head.
Bingo. So in other words, your occiput itself is, now you got to deal with this tilt over this direction. So And the reason why it's doing that tilt is because the instability and inferiority we have illustrated down here. So when we start addressing this and get you more centered from here to a little more here, the head itself either may still stay this way, or I may pump it up, calm it down to try to get it leveled over here. And by essence, it'll start calming your thyroid and everything else down here as well. So we're gonna start off with visualization. We want to do a thorough inspection. We want to see where the potential muscle spasms, that defense mechanism where the body trying to stabilize something. And also same story with the edema, the swelling, again, to help stabilize a unstable structure. So we have a lot of swelling over here, centered in the mid, more so on the left side over here. See, it's all swollen over here. See, we trace for pitting edema. So it just sinks right there. See, I'm gonna mark that level. See, this is chronic. It's barely there, but it still sinks right there. And then you see all these speed bumps here. See one over here, another one over here. It's all puffiness. So this looks like it's the 4, and this is the 5. Yep, this is the 5, and that's the 4. And we do have some swelling over here too, on the right hand side a bit, also on the left side. So everything's all pooling over here. See, it dips right there, that second sacral segment already, and nothing else. Interesting enough. How's this little fella?
Yeah, kind of painful.
Tender, right?
Yeah, a little bit.
Yeah, because what happened is with a slight external rotation of this hip over here, there's an open gap over here. So therefore, there's going to be some tenderness at this left SI joint over here. But not too bad on this one. See that? That's not moving too well. There's that EX component.
Definitely not.
This is PI slightly. Right there. Tender right there?
Yeah.
Yeah, see, that's your 2S right there. How's that fella right there?
A little tender.
See, that's your 5. Not great. Not that good either. 4, kind of decent. Right there.
A little bit right there, yeah.
You see, that's your 11. Right there. How's that fella right there?
It's not too bad, but still feel it.
It's not too happy either. And there's that side slip right there, number 2.
Yeah, right there.
Feel that huge knot right there?
Yep.
Yeah. Same here as well.
Oh yeah.
Yeah. Oof. Right there, huh?
Oh yeah, right there.
See, that's your 5th cervical. See, it's not tilting this direction, that's what I figure. Yeah, you do have a PLI. Okay, that's gonna be fun. See, the atlas is moving decent, someone's stuck. You see, there's that ASLOC support right there. There's a moderate fixation in there, but it's compensating. You can do it. Drop a little more. Oh, there it is. A little more. Oh, there it is. Come on up. Walk around.
Feels a little more freer, like the lower back.
Good.
Yeah.
How's the left sciatica now?
I don't really feel it as much as I did like before I came in.
Nice.
Yeah.
There we go.
Oh.
Okay, come on up. Walk around.
Oh, that's powerful.
What's different about this fella?
That lower back tension is slowly going away. I always had like stress here.
Mm-hmm.
Still kind of painful right now, but the tension's like kind of going away.
Good.
Yeah.
Any difference you notice in your belly?
Not yet, too early.
Fair enough. Because some people with IBS, they experience like gas relief or less belly pressure. So you gotta let us know in the future visit. Let us know how that's coming along.
Honestly, I do feel something in the stomach right now, maybe a little bit of relief, but yeah, I think you just gotta give it some time, see what happens.
Okay, let's get to the nerve to your stomach now. Everything's inferior today. Okay, let it go. Oh. Coming up. Okay. Come back. What's different about this one?
Not sure, like the upper back feels more loose.
Okay.
A little freer. That's the best way I can describe it.
How's your belly?
I don't really feel any like pain in the gut.
Well, you were having
Slight change, yeah, I'd say so.
All
I'd say it's like 40% better.
40% better. Hey, we'll take that. Okay. There you go. Here's one. There's that angle. Right. Oh. Hold on. See, now we centered your atlas. Feel that difference now? Got rid of your occiput. There it goes. Now walk around. Tell me, what's different from now?
Feels like I drank a cup of coffee.
Okay. Any other things you notice different?
I think a little clearer. Eyes are a little better.
Okay.
Like I can see better.
Okay. How's the anxiety? How's that?
I don't really have any anxiety
Okay.
right now. When you started filming, maybe a little bit, but now just like, it's nothing.
Okay. Do you feel a little calmer?
Yeah, absolutely.
All right.
I'd say so.
Okay. Okay. Open, close, open, close. Okay. Open, close, open, close, open, close. Actually, close. Yeah. Open, close, open, close. This is a little more in depth. Open, close, open, close, open, close, open, close. This is a little bit into open, close, open, close, open, close. Okay. All right. Stand up. Now give that jaw a try.
Much better. Like the numbness in the face is a little less. I've always had that too.
Uh-huh.
I gotta see after a day, but it feels good now.
All right.
Yeah. Just feels like blood wasn't flowing on this side of the face, going all the way down to the arm. Yeah.
All right, brother. That's what it's all about. I'll see you next time.
All right.
All right. So it's been a couple days. Give us updates. Everything.
All right, so some improvements. My stomach's a little better. Usually when I'm lying down at night, it grumbles and just like it feels discomfort. That's mostly gone. And another thing I noticed when I'm laying in bed, the heartbeat's consistent. Like the palpitations went away for the most part. I barely notice it anymore. A few other things, I wrote everything down because so much has happened. I'm a little less nervous. Sciatica is a little less lying down. Even though like it radiates down the leg once in a while, it's not as bad as it used to be. It used to be constant. So that's one thing I noticed. That's pretty much it for like the improvement. Should I go over like stuff I still have or?
Yeah, sure. What else you still got there?
I still got the tinnitus. I got like clogged inner ear. I think like has something to do with the eustachian tube or something like that. The occipital headaches, that still occurs. And there's like pressure at the back of the eyes. A little bit of sleeplessness, a little bit of dizziness, and the tightness in the neck right over here.
Gotcha.
Yeah.
Gotcha.
So that's pretty much it.
Okay. What about any difficulty focusing or memory recalls?
No, believe it or not, like the focus is a little better. Like my personality's coming back. Like I can't like talk with my hands again. It's just like No, it's just a different world I'm living in now.
Hey, that's great. So just a recap for you and also to the viewers as well.
Sure.
Biomechanically, remember your occiput is still tilted like this way.
Makes sense.
So yeah, we gotta stabilize everything down below, and eventually, either myself or your doc, back in Virginia, gotta address this AS occiput over there.
Oh, yeah.
Okay, whenever it does show up. So we'll do what we can in a short period of time.
Gotcha.
Okay, thanks for the updates. Let's get the final update.
All right.
Bring us up to speed. How's everything coming along?
All right, so compared to when I first came in, there's a lot of stuff that's changed. Like I can think a little better. I can, I'm not as like tired or like lethargic as I used to be. I still have like tightness in the neck, but as you mentioned, it's probably gonna take like a month or a few months to really correct because my spine is just kind of out of alignment.
Yeah.
And I've been reading online that a lot of the spinal or like the spinal structure, if it like kind of breaks from the bottom up, it can cause all sorts of like thyroid issues and like gut issues.
Yeah.
So it makes sense.
Yeah, because structure does determine function. So
Right.
because your base foundation itself and your lumbar spines, everything is, as we explained in the first video, you're leaning back so much, it's putting too much pressure and irritating the nerves to the thyroid. So
Right.
yeah, it's going to be a long-term process for your doc back in Virginia to start rebuilding your entire spine that way.
Oh yeah, but overall sciatica has been getting a little better. When I protrude my chest out, I can feel less tension in my throat. So I thought it was like an iodine deficiency or some kind of weird stuff. It just seems to be structurally related. So really glad I came in and kind of sorting this stuff out slowly as we go along.
All right, well, I'm glad. Okay, well, thank you for the updates.
Absolutely.
And have a good trip back to Virginia.
Thanks, Doc.
Hey, not a problem.